Welcome to Olympian Water Testing, giving you the best in water analysis. Today we're looking at the Washington State Department of Health. We're going to learn about arsenic, why it's in the environment, how can you be exposed, how can you be exposed through drinking water, and some more information about it. So first, arsenic is a naturally occurring element that's normally present throughout our environment in water, soil, dust, air, and even food. And levels of arsenic can vary from place to place due to farming and industrial activities. And that can form either organic arsenic that's coming from nature or inorganic that's coming from industrial means. And although they're no longer used, arsenic compounds were once the most widely applied pesticides in Washington. Past emissions from metal refining smelters in Tacoma and Everett have contaminated soil with arsenic. Arsenic from farming and smelting tends to bind strongly to soil and expected to remain near the surface of the land for hundreds of years, long-term source of exposure, and some underground aquifers located in rock or soil have naturally high arsenic content, while water pumped from these aquifers can have arsenic levels that exceed public health safety standards. How can you be exposed to arsenic? So everyone actually has daily exposure to arsenic. That's not to panic or anything. It depends on the amount and it depends what happens. So, with that being said, we're taking a look when human or natural activities have caused greater than normal amounts of arsenic to collect in the environment. The risk of developing health problems can be increased. Generally, the greater your exposure, the greater the risk of illness. Ways people can be exposed: drinking water, eating food, or ingesting things that contain arsenic. People swallow just small amounts of soil and dust. So young children normally put hands, toys, pacifers, other things in their mouths that can have dust or dirt on the surface. And arsenic isn't absorbed very well through the skin, but if hands are dirty, adults and children can swallow contaminated soil while eating. Also, breathing air, dust, and fumes containing arsenic is usually not a major route of exposure, but it can happen. So what are some health effects of arsenic? Swallowing relatively large amounts, even just one time, can cause mild symptoms, serious illness, or death. And that can include swelling of the face, nausea, vomiting, stomach pain, or diarrhea. Serious effects can include coma, internal bleeding, or nerve damage causing weakness or loss of sensation. Long-term ingestion, greater than 6 months, or smaller amounts of arsenic can be found in the environment, has the potential to cause a lot of health problems. Illnesses strongly linked to this type of exposure include bladder cancer, lung cancer, non-melanoma skin cancer, liver cancer, prostate cancer, kidney cancer, cardiovascular disease, diabetes, mellitus, damage to peripheral nerves, and the change to the pattern, color, of thickness of skin. For cancer, there's usually a delay of several decades from the time of exposure starts until tumors are seen. And many of these health problems, such as cancer, diabetes, and cardiovascular disease, are common illnesses that affect many people and have several possible other causes besides arsenic. So I'm not just blaming arsenic for this, but know that it can be a contributing factor. Now, how do you prevent exposure to it? Well, let's talk about the drinking water. Public health drinking water standard for arsenic is 10 parts per billion, and the Department of Health recommends that water used for drinking, cooking, and preparing beverages such as coffee and tea contain no more than 10 parts per billion arsenic. If your water contains more than 50 parts per billion arsenic, they recommend you stop using immediately, and usually it contains less than 3 parts per billion. Take it to a lab, have some testing, or take a look at some samples, or get a field analysis kit. Public water. If you get your water from a public system with at least 25 customers, your water utility should already be testing for arsenic. That doesn't mean it absolves you of the responsibility, but it's helpful. Your water utility issues an annual consumer confidence report will tell you how much arsenic is in your water, so make sure to look at the confidence report. If elevated levels are detected, a public water system will rely on consulting engineers to determine the best treatment method to reduce arsenic. And then smaller water systems and private wells. If your water comes from a privately owned well or a small water system, we recommend testing your water twice, once in the summer, once again in early spring, by a certified laboratory. If elevated levels of arsenic are detected, there are some home treatment systems that use reverse osmosis, distillation, or special filtration material to reduce the arsenic. Point of entry systems treat all water used in the house, and point of use systems treat the water as a single tap, such as kitchen sink, faucet, and keep in mind these treatment products may not be as effective in all cases, so it's important to continue testing your water after installing this equipment. And the good thing is there's different ways to find the amount of arsenic in your water, and even though we're exposed to it, it's a good idea always to test your water periodically, sometimes twice per year, to make sure that there's not elevated levels of arsenic in your water.